Hello, friends. Welcome to day 10 or 11 of the quarantine. Actually, I lost track of the lockdown. It's been quite a long time, and I hope everyone's safe, following all the precautions at home. So, I'd shared a post regarding I'm going to be making a video on coronavirus in pregnancy. It took longer than I imagined. I had to read a lot of papers from China, from Wuhan, from Seattle, the Royal College, and the American College, and recently the Indian guidelines, which are made by the Indian College of Obs and Gynae. So, more or less, all of them are similar. And a little more information from Wuhan because they are the ones doing a lot of research, a lot of work on it, and they were the ones who knew about it first. So, we'll come to that later. So what I managed to do is I made a set of five FAQs, which I have been asked repeatedly by all my patients and my other followers on Instagram. And this is what I could compile of the topic being coronavirus in pregnancy by Dr. Ankesh Sahitya. The first question was that what effect does coronavirus have on pregnancy? So the answer is very, very simple. Since the virus is so new, since it's in its fourth month of discovery from the time it got discovered in China, or maybe third month in the world, there's no real effect known. There's no textbook. There's no particular features that 1, 2, 3, 4 happens to a woman in pregnancy. It is just like a common flu. The simple flu-like symptoms of mild fever, running nose, headache, cold, and a cough. That's what it is. The older individuals, not the pregnant woman. A woman, if suppose say a woman is pregnant in her late 30s or early 40s, which can be a possibility nowadays, she is having the possibility of developing pneumonitis or pneumonia, as you call it, heaviness in the lungs. That's when it's a little thing to be afraid about. When someone develops some another individual having diabetes or anyone having any low immunity, like therapy for cancer going on, if they develop coronavirus, yes, it is a little immunocompromised condition. Someone on steroids, someone on immunomodulators, this could be the problem. So this is when you have to think of coronavirus and the possible symptoms. Otherwise, in a normal pregnancy of a woman who's between 25 and 35 getting pregnant with a common flu, don't think of corona first. I'm getting questions of patients asking me, should we get tested if they had a cough for 2 days? And patients are actually researching which lab to go to, where to go, where to out of the house. I don't think it's needed unless your physician or your doctor advises you. What effect will coronavirus have on my baby if I'm diagnosed with the infection? This is the second question I've been asked by more than 5 people. So it's a very, very new virus. There's no known evidence of coronavirus on the baby if the mother had it. There are about two cases in Wuhan in January. This is before 15th of January, where they studied a case of 10 women who had the coronavirus in pregnancy. All the 10 women had a delivery by normal delivery or by cesarean. There was no indication of corona causing the mode of delivery. Once they delivered, out of the 10 babies, two babies developed coronavirus. Now, this not been proven whether it's vertical transmission. Vertical transmission means when it's from the mother to the baby, in when the baby is inside the uterus, or it was happening after the baby was born because of contamination at after birth when the baby was with the mother or in the NICU or in the other wards. So there's no clear cut evidence of what will happen to the baby. I have a patient who's in early pregnancy and she's asked me what about the risk of early miscarriage and pregnancy loss. There's no statistical, no known evidence on pregnancy causing miscarriage in pregnancy because of coronavirus. That's also very, very important. Then a very, very good and practical question: what can I do to reduce the infection rate or contracting coronavirus while I am pregnant? So I would say there's no special thing in pregnancy you have to do. You have to treat yourself like a normal individual. There's no difference in pregnancy and normal person. Hand washing, social distancing, and following the curfew and lockdown, staying at home unless you have to step out. So hand washing and social distancing is my answer to this question as what one should do to prevent coronavirus in pregnancy. And yeah, a very common question which I get asked maybe 5 times a day is should I attend my routine antenatal appointments in pregnancy? Now, unfortunately or fortunately, this is the only way you can ensure your child's well being. But I have my take on this also. Some patients who are used to going to the gynac every 2 weekly, up to 32 weeks of pregnancy, this is something which is very important to them. Do they need to step out? If your patient is absolutely okay, patient is say 26, 27, 28 weeks, they have done a sonography recently before the lockdown phase, they need not worry. They can perceive normal fetal movements. They should ideally be in touch with their gynac on telephonic conversations or video conferencing. You can do, you can do an online consultation with your gynecologist, and he or she can reassure you of the well-being of the child and guide you what to do. There's no need to venture out of the house very often if you are in good health and you've been recently checked up. But yeah, this is definitely not the complete way to get checked up on the phone. Unless a doctor sees you, he can't be 100% sure. But yeah, there's no need to step up if there's no alarming symptoms in pregnancy. Now comes to the question after 32 weeks. Now, a woman after 32, 34 weeks has to visit her gynecologist weekly or sometimes in 10 days. It's very important to be guided by your gynac online regarding what are the warning symptoms of preterm labor, of pregnancy induced, of labor, things when you are impending to deliver very soon. Now, it all depends on the history of the pregnant woman. If there's history of previous preterm births, history of previous cesarean, history of hypertension in pregnancy, history of diabetes in pregnancy, you have to be guided accordingly by your doctor. You can't be having a generalized term to be at home and not be in touch. You have to be in touch. And trust me, all the doctors are working very, very hard to reach out to their patients, get knowledge of what's happening and guide them. Now, I would say if you're under 34 weeks, you need not go every weekly or 2 weekly. You should be in touch. Yes, if you're nearing your date of delivery or you are planning to get an elective cesarean because of previous cesarean, you have to be more in touch. He or she, your gynaec, will advise you what to do. Then a couple of people have asked me questions is that my sonography was due. I need to go for my NT scan or anomaly scan or my growth scan. Now, I have a very, very practical approach to this. If you are having a high risk of having a baby with an anomaly, if you're diabetic, if your maternal age is above 32, 33, if you've had a previous anomalous baby, if you've had, anybody has a doubt, then the NT and the anomaly scan are very, very, very important. You need to make this trip to get reassured. You can do your NT scan with your dual marker testing, or you can do your anomaly scan with your quadruple marker testing. Either or should be done. More importantly is the reason to not go out for a routine growth scan. If you are in your early third trimester or late second trimester, there is no hard and fast rule for you to go to a sonography lab, sit among a lot of patients over there, travel, make the trip and going out. The fear of the curfew and the lockdown should ingrain in your mind that during this phase, a normal routine growth scan or Leica scan is not essential. If you're perceiving fetal movements, if your OBGY, if your doctor says it is not necessary, please don't step out. I fully support and agree with the doctor. Even I would not tell my patient to go for a scan unless it is indicated. So the NT anomaly scan only if you have following in those criteria of patients. The growth scan only if you're above 34 weeks, you're fearing IUGR, you're fearing reduced fetal movements, you're fearing less Leica amniotic fluid, then the growth scan is important. Otherwise, I don't think it is very necessary to venture out during the lockdown, go for a sonography and get a normal report for reassurance. I completely understand everyone's feelings. I know I have a few patients telling me that, doctor, I wish I wasn't pregnant now and things like that. But don't loosen your heart. Don't feel bad. It's a beautiful phase of your life. Unfortunately, the situation outside is not so positive. But you have to distance yourself from people. Even social media, if possible, you can reduce reading those forwards, reduce reading those WhatsApp messages of all the positive cases. Be at home and be in touch with your gynaec online. I'm sure the future has various good things to offer, and I don't think one should worry at all. And I, as Dr. Ankesh Sayathi, am saying, I wish you all the best. May all of this be over very soon, and may we have a beautiful, positive future. Thank you.